Hydrocortisone aceponate, or HCA, is a unique new generation diester topical steroid. HCA is a potent agent which has been classified according to McKinsey's index with efficacy comparable to miconazole furoate. Additionally, HCA has comparable potency to beta-methazone valerate or dexamethasone and is far more potent than simple hydrocortisone. Despite its potency, HCA has a high benefit to risk ratio. With diester steroids like HCA, local side effects are rare and systemic side effects are uncommon. HCA also penetrates the skin for rapid onset and accumulates in target tissue for prolonged clinical effect. HCA was specifically designed to deliver potent anti-inflammatory effect with low systemic exposure and risk, while having a rapid onset of action and prolonged activity. Double esterification, the addition of two ester side chains, are key to the unique characteristics of HCA. The ability to fight inflammation quickly and effectively is essential for positive clinical outcomes. Rapid absorption of topical steroids in the skin is the first critical step. The ester side chain on HCA makes the new generation steroid highly lipid soluble, 60 times more lipophilic than plain hydrocortisone. This allows HCA to rapidly penetrate through the stratum corneum, making its way into the epidermis and dermis, quickly reaching effective drug concentrations to the target area. A study with radio-labeled HCA confirmed penetration to the dermis and subcutaneous tissue at 4 and 12 hours after topical application. There is an additional benefit to the high lipid solubility of HCA. The persistence of HCA in skin has been demonstrated for 2 days post-treatment in radio-labeled studies. This persistence provides an extended therapeutic effect beyond the dosing duration. Now let's look at what makes HCA such a potent anti-inflammatory with minimal side effects and a favorable benefit-to-risk ratio. The diester HCA is inactive. It is a prodrug and must be activated. This bioactivation takes place in the skin. Following absorption into the epidermis, esterase enzymes in the skin convert HCA to 17-monoester, HC17-propionate. HC17-propionate is a potent steroid with a strength comparable to miconazole furoate, beta-methazone valerate, or dexamethasone, and is far more effective than simple hydrocortisone. HC17-propionate accumulates at the inflammation site and reaches a higher concentration in the skin than conventional topical corticosteroids. Over time, HC17-propionate undergoes a co-migration and is converted to the 21-monoester HC21-propionate. HC21-propionate has significant anti-inflammatory effect, but is slightly less potent than HC17-propionate. HC21-propionate continues its migration down through the layers of the skin and is transformed once more into the weak anti-inflammatory hydrocortisone. Eventually, the drug reaches a subcutaneous tissue where it is absorbed into the bloodstream, carried to the liver, and quickly undergoes glucuronic conjugation. It is then excreted through the kidneys in the same manner as endogenous cortisol. As a result of its transformation in the skin, HCA exhibits high local efficacy and low systemic side effects, unlike conventional corticosteroids. In the modern classification of topical steroids, HCA is considered a high-benefit, low-risk compound. HCA is formulated into EASOTIC Otic Suspension for dogs, a novel treatment for otitis externa. The unique characteristics of HCA allow EASOTIC suspension to demonstrate robust efficacy with a low risk of side effects and an easy 5-day dosing regimen. Important safety information. EASOTIC, hydrocortisone aceponate, miconazole nitrate, gentamicin sulfate, otic suspension for dogs. For otic ear use in dogs only. Humans with known or suspected hypersensitivity to hydrocortisone, aminoglycoside antibiotics, or azole antifungals should not handle this product. Contraindicated in dogs with known or suspected hypersensitivity to corticosteroids, imidazole antifungals, or aminoglycoside antibiotics. Do not use in dogs with known tympanic membrane, eardrum perforation. The safe use of EASOTIC Otic Suspension in dogs used for breeding purposes has not been evaluated. Do not administer orally. For full prescribing information, contact Virbac at 1-800-338-3659 or visit us.virbac.com.